This webinar is to launch our appeal to raise money for the Geneva Red Cross. We'll hear about the great work that this organisation is doing in Geneva during this pandemic, and also how you can help them. The webinar is going to be 15 minutes long. You can ask a question in the chat box at any time. That's at the top right-hand side of your screen. And at the end of the presentation, I'll leave some time in case you want to ask any questions to us. I'll hand over to Benjamin from the Red Cross in a minute, but first I wanted to mention SwissDon, who've helped me and Tallis organise this initiative. So I'll just move on to the next slide. Okay. If you don't know SwissDon, it's an amazing organisation run by Nelly and Sylvia, who are on this webinar. I first came across them last year. They help companies like Tallis to set up donations through a micro-generosity scheme. It works by rounding up the amount in your shopping basket when you're buying something online so that you can give a few cents to your chosen charity. SwissDon say that pennies can make millions for charity, and I think that comes from a saying in France that small streams make a big river. In this extraordinary situation that we find ourselves in today, through their position and their network, SwissDon have seen lots of different acts of solidarity and kindness, and as such, they've been absolutely instrumental in enabling this initiative between SwissDon, Tallis, and the Red Cross. And I know I speak for them as well as myself to say how grateful we are for you for joining this webinar today. So thank you. And with that, I will hand over to Benjamin from the Geneva Red Cross.
Yes, good afternoon, everybody. Thank you very much, Lily, and also thank you very much to SwissDon for organizing this initiative. And I'm very proud to be part of it. So, my name is Benjamin Lachat. I'm working for the Geneva Red Cross in the fundraising department. And I will present you briefly what we are doing these days during this crisis. And please forgive my English, I'm doing my best. So I will start by explaining a little bit and very quickly what's happening right now in Switzerland. The number you can see on the screen are the number from Monday. So we have more than 21,000 people tested positive in Switzerland. In Geneva, it's 3,000 people. And in total, more than 700 deaths in Switzerland. And I think today we just reached 100 deaths in Geneva itself. The disease spreads quite quickly, and Switzerland is among the countries with the highest number of cases per capita. So I'm not an expert, of course, but and I think you will all agree, we truly hope it's not going to last too long. And of course, I'm sure you know, but the impact of this crisis are very severe, especially for the economy, for the employment. Right now, the quarter of the Swiss population is partially unemployed, so it's more than 1.3 million. The situation is really complicated, and we still not know what's going to happen at the mid and long term, but for the self-employed and precarious workers. Of course, we all hope that the action the Swiss government is taking in their favor will work, but of course, that will take a bit of time. Today, we'll maybe focus a little bit more on another impact, which is the social disconnection. And if I'm saying that, is because we, as the Geneva Red Cross, are trying to reduce the impact of this situation, precisely disconnection. As you can all imagine, the psychosocial effect of isolation on people is very severe. And in generally speaking, social disconnection puts older people, our seniors, at greater risk of depression, anxiety, etc. So as the Geneva Red Cross, we are really trying to support isolated people these days to reduce the effects of this crisis. So I guess the question today is, what do we do? By we, I mean the Geneva Red Cross. How can we help vulnerable people while keeping our staff, colleagues, beneficiaries as safe as possible? Well, I think today we are discussing and talking about solidarity, and really I will mention several times our heroes today. And I'm not talking about the Geneva Red Cross staff, but more about our volunteers who are also suffering from the effect of this crisis, but still are helping us every day to support the most vulnerable. So just few words maybe on the Geneva Red Cross. We were founded in 1864, so we are the first Red Cross society. We are a member of the International Federation of the Red Cross and Red Crescent Societies. Well, still we are an independent organization, but we are part of this big laws and base all its action on 7 fundamental principles, which are humanity, impartiality, neutrality, independence, voluntary service, which is very important these days, unity and universality. And really, us at the Geneva Red Cross, our main mission is to provide local assistance to the vulnerable population living in the canton of Geneva. So as an more than 30 projects everywhere, benefiting to children, seniors, migrants, and of course the most vulnerable people, such as, for example, homeless people. So today we chose to focus on Geneva, Switzerland, and the Geneva Red Cross, but truly this situation applied to the whole world. In every city there are other associations, including the Red Cross, taking action, and every cities in the world also face more or less the same situation with this virus. So our action, we are trying as the Geneva Red Cross to act where authorities and other social actors do not intervene. It's not our mission and our goal to duplicate what is already done by others. Really, we try to look for sustainability here, even if today we are working in an emergency situation. Today, really more than ever, we need external support because for your information, as the Geneva Red Cross, 40% of our revenue come from our own services, meaning we offer to the population formation trainings. We also have shops for second-hand clothes. And of course, when the crisis started, we had to stop all this kind of operation. So really today we are losing money every day, but of course that does not prevent us to continue our work. We'll see that the financial situation in few months. Right now, the emergency is our public, our beneficiaries. So since the crisis started beginning of March, mid-March, we had to completely reorganize the Geneva Red Cross. It means that most of our colleagues, of course, work from home, trying to keep contact with our beneficiaries remotely, making sure that they do not feel abandoned. It also means that we have to you in a few minutes. Of course, we define these priorities with the support of the authorities, and making sure that the coordination with also the other associations, social association, and the authorities, is well coordinated. That's very important. Again, the goal is not to duplicate and make sure that every beneficiaries, every vulnerable people is reached. So these days, our first priority is really supporting people at risk. What we mean by people at risk are, of course, our elders over 65 years old, isolated people, confined people, and in general, the most vulnerable people. So we gather a team of colleagues to put an emergency plan, emergency response in place, and contacted all of our volunteers in Geneva and tried to put some activities in place quite quickly. So what we provide right now is social contact for isolated people. These days, more important than ever to make sure that nobody is abandoned, feel abandoned, because otherwise the long-term impact will be really difficult and horrible for these people. So we need to make sure that at least we keep a phone contact with the isolated people by phone. We organized with our volunteers food delivery and medicine delivery to isolated people, animal care, disposal of domestic waste, and any other small services we can provide without direct contact. Because again, of course, the objective is to keep our volunteers, colleagues, and of course, the beneficiaries as safe as possible. So what we do is that what we did is that we organized hotlines and emergency email addresses, made a lot of advertisement in the newspaper, in the radio, etc. So that the people alone at home could contact us, and they do. A lot of them do. And then our team, the Red Cross team, put them in contact with volunteers living in their neighborhood. So then they can organize together what services we can offer to the beneficiaries. Something very important to say is that this service is completely free. We are not asking the beneficiaries to pay for the service. Of course, the one who can will reimburse us the shopping we are doing for them. It's important again to say that there is no financial transaction between volunteers and beneficiary. Everything is done by the Red Cross. We do not want useless interaction between the volunteers and the beneficiaries. And of course, for the beneficiaries who cannot pay for the shopping, the grocery, as the Red Cross will cover all the cost. I mean, that's part of our mission, even if it's a bit difficult this day, but we do it, and so far, so good. I'm very pleased to say that. So this day we have several hundred beneficiaries for this action, and just today more than 1,000 volunteers in the field. Our second priority is really to support the health service staff. Because as you can imagine, and as you know, it's really important this day that doctors, nurses, and whole social services staff are able to go to work. I mean, they are in the front line and they need to be supported. So we decided to support them through two main activities. The first one is a childcare service. We call it in French the Chaperon Rouge, the Red Riding Hood in English. And basically, we send a babysitter. I do not know exactly the word in English, so I call them babysitter, but actually that's experienced and trained professional babysitters, adults. So each time a doctor, nurse, etc. needs his children or her children taken care of, we'll send them for free babysitter to their home. We have also another service of community interpreters. So it's several hundred people covering more than 200 different languages. And these days they are very active within the hospitals, making sure that the patients not able to speak French are understood and understand the doctors, the nurses, etc. Of course, more than ever, the communication has to be fluent and very clear, and we need to make sure with this quickly evolving situation that everybody understands each other. So our babysitters and our interpreters are definitely our heroes, because they are every day in contact with sick people, but none of them decided to stop their activities. Of course, we asked them at the beginning of the crisis, and none of them stopped. So they are really our heroes, and we are so grateful for their work, and that's really impressive. And of course, we are in direct contact with the health authorities, and we are making sure that we are taking all the necessary measure and precaution to keep them safe and healthy. And of course, it's a lot of anxiety, but really they are doing a great job, and it's really great because it really helps their staff, and these days that's very important. So these are the two main priorities. So the first one is really supporting people at risk, and the second one is supporting the health service staff. And they're not stopped, but they are done remotely, and we are really doing our best to keep track on our beneficiaries and make sure that they are supported every possible way. So that was very short, but thank you very much. I really appreciated this opportunity. Really do not hesitate to contact me should you want more information. I'm really at your disposal. And should you want to become a volunteer, you can always register on the link you can see on your screen. Thank you so much. So it's back to Lily then.
Yes, back to me. Thank you very much, Ben. That was brilliant to hear that. Just want to check that the slide is still up. So I'm just going to finish off by explaining to you how you can help by donating, hopefully. So I've put up on the screen here the link, which is on our Tallis website, for the Geneva Red Cross appeal. If you go to this link, you will see there's an option to donate whatever you can. It starts at 10 francs. And just to give you an idea of how that would be used, 10 francs would buy a meal for somebody who is vulnerable. 20 francs would cover a whole day of food. 50 francs pays for somebody who's elderly or isolated to be comforted. For somebody to be with them, and 100 francs covers half a day of childcare for medical staff. So that's the Chaperon Rouge, which Benjamin was talking about, which I as a parent have made use of when I was stuck and in trouble, and I can say that it's the most amazing service. So being able to support that is wonderful. So there you go. So there's the link. If you copy that down, please visit it and consider giving whatever you can to help this amazing cause. We will all be so grateful. I will send an email after this webinar with that link as well. And whatever happens, if you could also try to share that link with as many people, try and send it to 10 people today, and that will help us spread the word about this appeal. So that's it for today. If you have any questions, please feel free to unmute and ask them, or write them in the chat box if you prefer. I'll have a look for that now. But either way, as I said, we will send a follow-up email, and you can reply to that with any questions for Benjamin or I, or Nelly and Sylvia from SwissDon. Okay, so unless there are any questions, I think we will finish there for the day. Thank you so much for listening in. Have a lovely rest of your day. Goodbye.